Hello, everyone, and welcome to a toolkit to manage cancer-related disability. We're glad you could join us. My name is Elaine Gonzalez. I'm the community educator at the Breast Cancer Resource Center, or BCRC. I'm pleased to serve as your moderator today. The Breast Cancer Resource Center, BCRC, is a community-based nonprofit serving Central Texas impacted by breast cancer since 1995. Strengthened by our mission to empower those affected by breast cancer with personalized support and compassion, and in collaboration with our community partners, BCRC envisions a future where no one faces breast cancer alone. BCRC offers individualized patient-centered care from diagnosis through treatment and into survivorship. Through its two pillars of support, guidance and education, BCRC certified patient navigators, whom are all breast cancer survivors themselves, empower those touched by breast cancer to become active and knowledgeable participants in their healthcare journey. This program is provided as part of a cooperative agreement awarded by the Centers for Disease Control and Prevention to expand our programs for young women. The purpose is to increase the availability of support services for young breast cancer survivors, young women, and metastatic breast cancer and their caregivers and families. We are honored to have with us today Amy MacArthur, PhD candidate, and Dr. Rochelle Brick, postdoctoral fellow. Thank you for joining us today. Let me stop sharing. Thank you for joining us today. I will turn the presentation over to you.
All right. Hi, everyone. Thank you for joining us for this conversation about cancer-related disability. So I'm Amy MacArthur. I'm currently a PhD candidate at University of Illinois at Chicago. And my dissertation research, which I'm completing as we speak, is on experiences of young women who have a history of breast cancer and how they experience participation changes after treatment ends. And I'm also an occupational therapist with experience working with adults in inpatient hospitals and rehabilitation settings. I'm going to hand it off to Rochelle.
Hi, everyone. My name is Rochelle Brick, and I'm also an occupational therapist and currently a cancer prevention fellow at the National Cancer Institute. So after working full-time as an occupational therapist, I transitioned into research, where I am now full-time, and I study cancer-related disability at different phases across the cancer experience. And I also study access and delivery to rehabilitation services among cancer survivors. And so today, we really hope that you'll take away 4 big ideas. So first, we hope that you'll be able to define what cancer-related disability is. And we also want to share which healthcare team members can help you to manage cancer-related disability. Then Amy will share some strategies and tips on how to talk with your healthcare professionals about cancer-related disability. And then lastly, we'll share some strategies that you can use on your own to manage different types of cancer-related disability that you may experience. And so I keep tossing out this term, cancer-related disability. Well, what really is this? Disability is a part of being human. Almost everyone, either temporarily or permanently, will experience disability at some point in their life. And oftentimes, cancer-related disability is associated with a health condition, such as cancer, where you experience pain or chronic fatigue. Maybe it's depressive symptoms or changes in your memory and thinking due to cancer treatment. However, cancer-related disability is really broader than just a side effect or a symptom. Cancer-related disability truly is that interaction between individuals who have a healthcare condition with their broader surroundings, whether that be the environment or different personal factors within themselves. So this may be negative attitudes from the society or inaccessible surroundings. So they're not being an elevator, they're not being railings on a stairway. And so we often feel this disconnect occur when we try to do things that are really most meaningful to us. So, for example, cancer or cancer related treatments may make it more challenging for you to attend work activities or to engage in basic daily activities like dressing, bathing, or toileting. Now, cancer related disability can happen before treatment, during treatment, after treatment, and even years beyond treatment completion. So, recent studies have shown us that nearly 65% of cancer survivors will experience challenges with physical function. And this may be climbing stairs or walking in the neighborhood or your community, and even lifting grocery bags. Nearly 54% of individuals have reported difficulty working or returning to work after cancer. And this 54% of cancer survivors also includes reporting difficulties with caregiving for loved ones or shopping within the community, which is typically a part of our daily routine. And we also know that 40% of survivors may encounter difficulties even with our most routine tasks. So this would be that bathing, dressing, toileting, getting to and from your kitchen table to your living room couch. And so it's these really common activities that allow us to go about our day-to-day routines, but we have difficulty with.
So Rochelle's given us a really good overview of what exactly cancer-related disability is. And next, I wanted to talk a little bit about cancer and the Americans with Disability Act, or the ADA. So you may already be familiar with this, but the ADA is a federal civil rights law that prohibits discrimination against people with disabilities in various activities of daily life. And according to the ADA, a person with a disability is someone who has a physical or mental impairment that substantially limits one or more major life activities, has a history or record of such an impairment, such as cancer that is in remission, or is perceived by others as having such an impairment, such as a person who has scars from a severe burn. If a person falls into any of these categories, the ADA protects them. You do not need to apply for coverage because the ADA is a law, it's not a benefit program. So, what exactly does this mean? You don't necessarily need to identify as somebody who has a disability. However, the ADA does mean that you have a right to not be discriminated against in public life due to your history of cancer or cancer related side effects. So, this can apply to things like seeking employment, engaging with local and state government services, using public transportation, and accessing businesses that are open to the public, and a few other areas of life. So, people with disabilities must have equal opportunity to benefit from engaging in these activities and services. And this can be accomplished in a lot of different ways, including the availability of things like reasonable accommodations or other supports that allow people with disabilities to participate in the activities that they want or need to do. So next we're going to transition a bit to talk about different services that might assist you in managing cancer-related symptoms. So there are a few different kinds of healthcare professionals that can support you in managing your cancer-related disability. We're going to give you a little bit more information about who they may be and how you can talk to those providers to get your needs met. So first, before you even make an appointment, you might want to get prepared to make sure that you can clearly communicate what's going on with you and what you need from your providers. So these are just some tips that may be relevant and helpful, but of course, you're going to want to find what makes the most sense for you and what's the best fit for getting ready for communicating what's going on with you. So first is to be prepared. So this can include writing out your concerns before an appointment, either in a notebook or on your smartphone, bringing something to take notes with to an appointment, like either of those things. And if it makes sense for you, bringing a support person like a family member or friend that you think would help to kind of make sure that you hit on all the topics you want to discuss during an appointment with your care provider. And then you also want to try to identify your top concerns. You know, you probably already know appointments tend to be a bit short, so you want to make sure you hit on the topics that are most important to you, and make sure you have time to make a plan to address these with your provider. And then next, you want to really think about how you're going to explain the impact of the symptoms you're experiencing on your daily life. Many healthcare providers are at least somewhat aware of side effects that are common after a breast cancer diagnosis or treatment, like lymphedema or fatigue, but they might not know what that actually means to you in your day to day life. So, thinking of an example of how that's impacted your ability to complete things that are important to you can help providers understand that this is something important and we should really address this rather than saying, okay, you know, I'm sorry that happened. Are you still doing okay? That sort of thing, and kind of moving on before that gets addressed. Um, and then, if you already know what you think would help you to manage these symptoms, tell your provider what you want or need. Ask for any referrals that may be relevant or necessary. And if you don't think you know what exactly you need to kind of manage these symptoms, ask your provider for their opinion of what could be helpful. So, just kind of working together to access what you think would be helpful to you. Next, Rochelle is going to give a brief overview of some services that may be relevant to help you manage your cancer-related symptoms.
Thanks, Amy. So there are a variety of healthcare team members that can address cancer-related disability. And often you'll first need to report your symptoms to either your oncologist or primary care physician to really receive referrals or recommendations for which providers or services would be that would be a great fit for you. Next slide. And so one of the primary healthcare providers that can help you overcome or manage cancer-related disability is an occupational therapist. And of course, Amy and I are a little biased just because that's where our clinical training is. But occupational therapists can help you to engage in the activities that you need and that you want to do. An OT, that I'll refer to for short, can help you to find assistive technology or tools that may help you to overcome challenges that you may encounter. So these may be tools to help you reach items on top shelves, or especially if after surgery, if you have limited range of motion or lymphedema. These tools also may be weighted silverware, for example, to help you to overcome some of the changes in sensation due to peripheral neuropathy. OTs can also help you to adapt your environment to make tasks easier and things more accessible for you. So often OTs can come in and we can help you reorganize your pantry or your setup to have a different desk layout in order for you to have better access to the information and to the tools that are most important for you to complete your day-to-day activities. Now, OTs can be found in a variety of healthcare settings, whether that be outpatient clinics as well as inpatient hospitals, should you have any acute medical needs where you have to stay overnight in a hospital. Now, if you or a loved one are restricted to your home due to disease challenges or limited transportation, your doctor may also consider referring you to a home health OT that can come to your home directly and work with you from the home setting. Next slide. Another healthcare provider, which may be familiar to many of you, is a physical therapist. Physical therapists can really support individuals who are experiencing changes in their range of motion, their ability to walk throughout the community or in the home, or just changes in your overall strength. They are skilled in providing exercise programs that can support your ability to walk and manage throughout the home and the community. And similar to occupational therapists, they are commonly found in outpatient clinics. I'm sure many of you have driven down the street and seen lots of different therapy clinics all throughout your community. They're also available through home-based settings as well as inpatient hospitals. For younger survivors, access to both OT and PT services may also be available through school-based services as well, where cancer diagnosis of children or adolescent and young adult populations is commonly available. Another individual that you may work with is a speech language pathologist. And while speech therapists are often known for their skills to help individuals to swallow or recover from speech after, for example, head and neck cancer surgeries, they're also highly skilled in the assessment and treatment of cognitive impairment. Often with many cancer diagnoses, cancer-related cognitive impairment is a frequent and debilitating symptom. And SLPs can really help you to incorporate different nonverbal communication strategies or help teach you problem-solving skills to overcome these challenges. So, for example, they might have you set up a reminder system to better understand when your appointments are, or they may help you to think of different strategies. We've all had that sensation where it's, where is that word? What's that name? Who's that person? And we can't just pull it off the tip of our tongue. And so they can help you with strategies to overcome those limitations. As we continue to build this professional list, I also want to highlight the specialty of physiatry. A physiatrist is a doctor who specializes in the management of disability through specific medical interventions. So, whereas physical therapists, occupational therapists, and speech language pathologists can't necessarily prescribe medical or pharmacological interventions, a physiatrist is able to do this aspect. So whereas a cardiologist, will manage your heart concerns, the physiatrist will help you to manage disability and physical changes that can result from cancer. And so a physiatrist may help you to find a medical routine through different pharmaceuticals, and they can also help you navigate accessing these different rehabilitation services that complement their form of care. And one of the last providers I want to mention to you is exercise specialists and personal trainers. So, if you feel like you are able to manage cancer related disability, but you want guidance in order to stay active and really engage in healthy behaviors in your day to day routine, an exercise trainer or specialist may be a form of support that could help you. So, there are thousands of gyms available, but really only a fraction of trainers, or these gyms, I should say, have exercise trainers who are credentialed and specialized to help individuals who have had a cancer experience. Now, on the screen here, you'll see this screenshot of the ACSM Pro Finder. The American College of Sports Medicine has a fantastic online tool that can locate certified and specialized exercise trainers that are located near you that have this cancer credential. And so you would go in and click the Access ACSM Pro Finder, and you can enter in your zip code, and then you'll be able to see all the gyms and the names of those trainers that have these credentials available to you.
So Rochelle already set me up a little bit by talking about the exercise trainer finding tool, but now that you have an idea of some providers that may be relevant to working with you to manage symptoms that can occur after a breast cancer diagnosis, how exactly do you go about accessing the providers that may be helpful to you? So here's just a couple of tips or things to keep in mind when looking to set up an appointment with somebody new to you to manage these symptoms. The first thing is that some, but not all of these services may require referral. Many states have what's called direct access laws for services like physical therapy and occupational therapy. And what this means is that you can receive evaluation or some treatment without the need for a physician writing a referral. This is going to be dependent on state laws, your insurance, and also policies of the provider you're accessing. So you'd want to call a clinic or hospital system that you're using to have them check everything before you make that appointment. And then once you've kind of identified the provider that you think you may want to work with to address your cancer related symptoms, you want to take some time to make sure that you're finding somebody that's a good fit for you. So one tip that I got from the American Physical Therapy Association on their website dedicated to oncology PT was asking a clinic or provider, when you make an appointment, do you typically work with those who have been diagnosed with cancer? And there's no right answer to this question, but as Rochelle mentioned in regards to exercise trainers, not every occupational therapist, physical therapist, speech language pathologist is going to have experience or additional training specific to the needs of cancer survivors. So they might not have all the tools to meet your needs because that isn't the area that they've sort of specialized or focused in throughout their career. Um, when you ask this question, you can ask for some examples of how providers that you're speaking with have worked with individuals with a history of cancer. So you can kind of get an idea of what to expect or how they may work well with you. And as best as you can within the limits of your insurance provider, try to find somebody that you think is skilled in meeting the needs that you specifically have. Um, So next, we're going to transition to talking a little bit about specific examples of things that might help you to manage cancer-related disability in your day-to-day life.
Okay, so often the first thing that we think about, or at least what I think about, is what can I change about myself? And in most cases, we know that we can't zap away symptoms or limitations or, just make quick changes to our own biology. And so we need relief from these changes to do the things that we need to do and we want to do. So if you can't change yourself, well, what can you do? So the first thing that we can think about is changing our environment or the surroundings that we're in. This might include physically arranging or rearranging where items are in your closet or your office. And it also might include leveraging your friends or family, just the social support that you have around you. Now, the other bucket of solutions could be changing the task itself or the way you go about completing a task. So by using a consistent routine and different, what we like to call energy conservation or work simplification tips, you can really allocate your energy, whether that be from your mind or your body, to do the complex tasks that you need to do to manage any changes that you have. And so let's dive, these are two very broad statements that I shared with you, two very broad categories. And so I think it'd be easiest to, really apply these tenets to activities that make up your day-to-day responsibilities or ones that commonly will. So it's really important, first and foremost, while you're managing your self-care, to keep a daily routine that keeps your activities that you must do, like grocery shopping or paying bills, as well as the activities that you enjoy doing, as regular as possible. So self-care, such as showering, toileting, and dressing, are just some of those activities that you must do. And the way you go about accomplishing these tasks can largely influence how pronounced different disability or that disability experience may feel to you. So having a routine is one of the best ways to reduce the perception of limitations. The more consistent we are with our routine, the less taxing an activity is on our brain or our body. So our science shows us that as we build habits, we require less brain activation, and it makes limitations such as different aspects of cancer-related disability less noticeable. I also really encourage that you try to make small adjustments to the way that you perform the tasks that you need to do. So for example, you could try sitting while drying your hair or shaving your face. And you can add a shower chair to your bathroom setup if you notice that you're tired even after a quick rinse. It takes less energy to sit than it does to stand. And so often if you're experiencing chronic fatigue, pain, cancer-related cognitive impairment, this is one way to help you save some of that energy and have those feelings as less noticeable. And there are also a few things that you can do to your home setup to just adapt to the different challenges that you're experiencing. So for me, I like to keep frequently used items at eye level or easy to reach locations. Again, make your routine predictable. We often exert quite a bit of energy and mental concentration when we're jumping to get something off of the highest shelf or awkwardly, contorting our body to get something that fell underneath the car chair. And so If you can just find yourself moving around to get clothes or body care items or devices to more commonly accessible areas, you may then be able to condense these materials, for example, to one cart for the morning or one cart for the evening for your self-care routine. This way, everything is just in one place and you don't necessarily have to do as much problem solving. Now, I'll actually have you go back for one quick second. I'll also make mention that for individuals who are experiencing a lot of cancer-related cognitive impairment, so this may be short-term memory troubles or, again, trouble just attending to a task. Using a cart or an anchor place in your home to keep items is a really good solution, so you won't need to rely on your memory to search for those items. Now, for many, the next part of your day after you get ready can involve a work activity. And this is something that work-related disability is, again, nearly 54% of individuals struggle with, and it is a hot topic, especially in cancer survivorship. Now, this could be, formal work, or it could be a volunteer position or one for payment. Now, for a child or an adolescent, remember, work is being a student. And so while work is an essential component to our lives, it's also one of the parts where disability is most noticeable. And so you can click, Amy. Limiting multitasking. You want to minimize distractions like email and phone texts and focus solely on one work task at a time. Amy, can I just get a thumbs up? You can still hear me. It said I have, perfect. It said I have unstable internet. I'll keep going though. So again, minimize distractions like email that's around you or phone calls that may be coming in while you're trying to do a task. And this way your mind is not trying to make sense of switching between topics or dividing its attention. Now for students, you can try and sit in an area that doesn't allow your mind to wander. You can sit towards an aisle or the front of a classroom. And for those who have difficulty recalling names or phone numbers, keep a printed list accessible on your desk. You can tape it to your computer, put it underneath your keyboard, and make it as discreet or obvious as you feel comfortable. And so by having those names present, you'll be able to grab them at just a moment's notice. If your job also allows, you may consider rearranging when you actually do your certain job tasks. So for me, I know that I have better attention in the morning hours between 9 to 12. So I try to focus the most difficult or complex tasks that I have to do during that time period, because I know once post lunch hits, it's not going to be as clear and flawless as I may be in the morning. I'll have you click again, Amy. Perfect. So the next tip is to read as much printed material rather than reading from a computer. In this post-COVID world, I know this is exceptionally challenging. I mean, look here, we're on the computer for an hour going over this discussion together. But when opportunities present, I highly recommend to use this tip to your advantage. We know that paper materials can sometimes be less taxing for individuals that are experiencing chronic fatigue as well as cancer-related cognitive impairment. And then lastly, I highly recommend that you speak to work or ask for school accommodations. As we learned earlier, cancer-related disability is a legitimate condition that warrants accommodations without hassle. You are entitled this right. And so employers and educators are mandated to support you. And I encourage you to access these supports, which Amy will share a little bit more about.
Thank you, Rochelle. So like Rochelle mentioned, requesting and securing workplace or school accommodations may assist you in navigating what work means to you in your day-to-day life and being successful. So I wanted to kind of give a couple examples of what that can look like and how you may go about requesting accommodations if you feel that would be relevant to you. So first, I'm going to give you just 2 examples of possible accommodations that could be appropriate for somebody who's experienced breast cancer. So the first one is a lawyer with cancer who was experiencing lapses in concentration due to a medication she was taking. And the solution that she found with her employer was to kind of block off her schedule to give her uninterrupted time during her morning to work, without those distractions, like Rochelle mentioned, of emails and phone calls and various meetings that you're transitioning between. And her workplace also offered some remote work options so that she could have a little bit more flexibility with her schedule and be able to concentrate more easily on the tasks that she needed to do. The next one is a security guard with a history of breast cancer who experienced a burn from radiation treatment and was experiencing some discomfort wearing the polyester company uniform. So the solution was the company modified the dress code and allowed for the use of a cotton uniform for this employee with an embroidered insignia instead of like a patch that was adhered and an embroidered employee name. So adjusting this requirement of employment allowed for increased comfort and ability to do the job of being a security officer. So these are just 2 examples of possible accommodations that employers may be open to providing. There are some other examples, such as the ones Rochelle talked about, but you can think about modifying a workstation to conserve energy, adding in a seating option or other ergonomic support so that you're not using as much energy to complete some work tasks, changing the lighting of your workspace so it's easier to concentrate, limiting the use of background music in certain workspaces so that you can have an easier time focusing. And there are many other strategies that may be appropriate and helpful based on a work situation that is your own. Um, Accommodations are really dependent on the individual job function and would be something that is discussed with your employer in an ongoing way. You might try something out and it doesn't really work to meet your needs. So you might have to kind of modify that and find something that works best for you and your employer based on what the job demands are, if you think that would be helpful. The list we provided in this talk is not at all exhaustive of what is possible. And I encourage you, if you think this is something relevant to you, to access one of the resources we'll talk about later, which is the Job Accommodation Network, because they give you a really nice overview of a laundry list of different accommodations that can be possible. And we'll talk a bit more about that later. So after giving some of those examples, I wanted to talk about what would you do if you were actually requesting a workplace accommodation. The first thing to know is there's no official way or process that is the only right way to request a workplace accommodation. This is going to be extremely dependent on you and your employer and really what their process is. So first you want to decide how you want to make this request if you think it's something that would be relevant to you. It can be an in-person meeting, an email, a phone call, or whatever is appropriate based on your workplace. And some employers might have a system that's in place through their HR department that you would kind of go through those steps that are dictated by your company. If you're submitting a written request, there are examples of requests for accommodation letters online through various websites that, including the Job Accommodation Network, that can kind of give you a script of what might be helpful to include. Next, you're going to want to think about who you are going to ask for this accommodation. And it can be a lot of different people, but often it might be your direct supervisor or somebody in human resources that can help work with you to get this put in place. And you want to make sure that you explain why you need an accommodation, and you want to provide some options or ideas that you think might be helpful. It's not guaranteed that those are going to be the things put in place, but you want to come to the table saying, I think this might work well for me. And it'll kind of be a conversation back and forth to figure out what the plan will be. Make sure that your request relates your is related to a medical condition, not just a personal preference. So an example I have here is an employee tells her supervisor, I'm having trouble getting to work at my scheduled starting time because of medical treatments I'm undergoing. So it's clear in this statement that the request is not just because I don't want to come to work at the time I'm scheduled. It's I have these medical appointments that are difficult to change. Is there something we can do to adjust my schedule so that I can meet the needs of my job while also attending to my medical needs? Um, and then lastly, you want to follow up with your employer as needed and really think about this as a conversation that's pretty open ended. Just because an accommodation is put in place doesn't mean that's the only thing available to you. If it's not working, say that. Ask for something different. Really figure out what's going to be best for you going forward and make sure that it's a good fit. I think it's important to note here that it's really up to you if you want to disclose your history of cancer to your employer. It's not something you're required to do. So this is really up to you whether or not this feels like it's something you feel comfortable doing in your workplace. So there's no right or wrong with this. It's really going to be something you decide on your own and figure out the best path for you. So next, I'm going to hand it back to Rochelle to talk about a few other areas where you can kind of help manage symptoms you're experiencing.
So another area of your life that you will commonly experience where you may experience cancer-related disability is your leisure activities. And leisure activities encompass all of the things that we enjoy doing. And so managing your energy and making these events really predictable helps individuals or cancer survivors that I've been able to work with compensate for cognitive impairment or pain or challenges in their mobility. So to keep the many different activities straight, incorporate use of an agenda that works for you. Whether it be your phone, your email calendar, or a paper agenda, you can try using a method that just really clicks best for you. If you tend to forget taking medications, set phone alarms or reminders that will prompt you to take the medication. I also really recommend spreading your activities throughout the week. This will allow you to preserve your energy and manage fatigue in order to be able to accomplish all the tasks that you need and want to do. Another idea that often really supports many with cancer-related disability is carpooling. Driving is a really exhausting task and one that requires us to use a lot of our memory and thinking skills, our coordination with our hands, sensation in order to feel the steering wheel. And so it's okay to ask a friend or a family member to assist with driving. And there are also different programs that can support and subsidize rideshare programs like Uber or Lyft through various nonprofit organizations to help you get from point A to point B. Now, if you can save some of that brain power again, rather than drive, you'll be able to better engage in that activity. And then lastly, if it's possible, try to schedule activities in a quiet area. When there's less distraction, your mind is able to use less energy and process information better. So again, helping you to manage or overcome cognitive impairment or fatigue. And then just very broadly, and I'm sure this is something that many of you either have tried to incorporate or are actively doing, sleep and relaxation. Sleep is truly critical for brain recovery and cognitive processing. And well, again, I'm sure you've seen many of these strategies before. We really recommend including that 5-minute meditation into your day, having a consistent wake and sleep time, or reducing your caffeine and television. They say them because these are evidence-based strategies that can support your day-to-day routine. Next slide.
So, lastly, I just wanted to talk a little bit about self-advocacy and cancer-related disability because, excuse me, self-advocacy is really a set of skills that will be helpful for you to implement some of the strategies that we talked about today. So you might already be familiar with this term, but if you're not, self-advocacy just means having the skills and knowledge to communicate your cancer care needs. And it's sort of a collection of skills that you can develop over time so that you're able to both know the needs that you have and communicate those needs to those around you in order to kind of try as best as possible to have those needs met so you can do the things you want or need to do. So, the National Coalition for Cancer Survivorship identifies 4 skills that support self advocacy. The first is information seeking. So, educating yourself on cancer, possible side effects, and support services. You're already doing that by being here today and learning about this. The next is communication. So, being able to organize your thoughts and discuss them with people around you that need to know about what's going on with you, like your healthcare providers, family, friends, employers, etc. Problem solving, making decisions about your care and participation in daily life that are best for you. So you can do this on your own or in communication with other people around you that are important to you. And finally, negotiation. So this is working with others to make sure that your needs are met. Using self-advocacy skills can really help you get the care and supports that you need to manage lasting symptoms from cancer and to allow you to participate in the activities you want or need to do. So next, I just have a couple of resources and then we'll open up the Q&A, but I wanted to mention these here because disability and cancer is such a large topic that there's no way we could have adequately addressed all aspects of it, but we think there are some organizations that can help you kind of get more information and learn more. So the first is the ADA National Network, and this has a lot of resources that can help you understand what the ADA is and how it might apply to your experiences. They have a phone line that you can call with questions. And within that network, there are also regional centers that are a bit more dialed into local concerns related to ADA implementation in the region. The next, which I mentioned briefly before, is the Job Accommodation Network. And they offer free expert guidance on job accommodations and disability employment issues. So they offer consultation to individuals and employers to help promote employment opportunities for people with disabilities. The next is Cancer and Careers, and they seek to empower and educate people with cancer to thrive in the workplace by providing expert advice. And they have a lot of interactive tools like an online discussion board where you can ask career coaches questions and stuff like that. Next is Triage Cancer, which offers educational resources on practical and legal issues that might arise following a cancer diagnosis. And they offer legal and financial navigation programs to individuals, so you can reach out to them to get their assistance in that area. Cancer Legal Resource Center is part of the Disability Rights Legal Center, and they offer legal information and resources at no cost. They have a telephone and online assistance program that offers resources to individuals. And lastly is the APTA Oncology, which is a website from the American Physical Therapy Association that really highlights how physical therapists can work with individuals with cancer to maximize movement and wellness across the lifespan. And they have a provider locator tool that you can use to kind of see where you can work with a PT near you who is specialized in oncology care. So next, I'm going to just say thank you, and I'll stop sharing and open up the floor for questions.
Thank you. That was such a great presentation. We do have a couple of questions. A comment, first of all, in the chat box. Kim said, my employer eventually approved my work from home request due to my long-term side effect of bronchiectasis and the risk of exposure to respiratory illness. They required my pulmonologist to complete the ADA paperwork. She said this has been very helpful for me.
Thank you for sharing, Kim. And as your example highlights, there may be requirements specific to your situation. In this example, the pulmonologist filling out some appropriate paperwork. So like I mentioned, there's no sort of direct instruction of what that process would look like. You're going to have to kind of figure out what that would mean for you based on your employer and their policies.
We had another question come in. Is shiatsu a Chinese massage? Painful spots, pressure points are used as pain modifier. So is this massage alleviating some of the pain?
I really appreciate that question. Something that I've been trying to learn a lot more are different complementary and lifestyle medicine approaches that can support healing and management of different symptoms. So for that particular technique or that massage technique, I'm not familiar if it is, evidence-based to relieve pain. However, there are different studies that have focused on massage technique, acupuncture, and acupressure, which are effective at reducing self-reported pain, fatigue, as well as nausea and vomiting symptoms. And so it's something that you absolutely should discuss with your provider as something to complement the current treatment regimen that you're using. Many physical therapists, along with certain exercise physiologists and some occupational therapists, are trained in certain massage techniques. Some massage techniques can even expand to management of lymphedema. And so, if this is an area that you'd like to explore further, I recommend, again, you speaking with your provider. I'm sorry, I can't necessarily comment to that specific technique, but there is evidence to support massage, and certain insurances will cover it. So definitely look at your insurance, what you elect to have and what is available in your insurance plan, as you may be able to have certain coverage of the massage therapy techniques.
Great. We had quite a few questions, pre-questions come in about disability, SSDI, and I know that we didn't touch on that a lot today because we were really focusing on the actual disabilities themselves. But there is one question that came in. Can breast cancer condition be a reason to apply for disability? So can you speak to that a little bit?
So, I will say that, yeah, the short answer is yes, it can be. Just from my dissertation research, some of my participants did utilize short-term disability or Social Security disability insurance. However, the process to securing that is going to be really individual. So you might want to look to some of the legal resources that we provide in this presentation, because they'll be able to give you more targeted recommendations of how to navigate that process and what would be relevant to you. If you're seeking short-term disability through your employer's insurance, you'd have to go through their system. And there are a lot of different sort of pathways to access benefits, which are very relevant to this topic, but a little bit outside of the scope of my expertise. And also, there are resources out there that can give you that individualized one-on-one recommendation based on your situation and what is really appropriate for you. So I can say, yes, it's a potential reason to apply for those benefits, but I can't guarantee that you'll get a certain benefit level for any of those, because as people may know, it's usually a back and forth conversation to get things approved.
Yeah, there's a lot that goes into applying for disability. So those resources, I again highly recommend those as well. So I'm not familiar with MetroLift. Are you familiar with MetroLift?
I'm not familiar with MetroLift either, but would it potentially be like a paratransit sort of?
I
Yeah.
believe it's transportation, yes. And so I think this question is talking about maybe just kind of any kind of transportation assistance. Can a breast cancer patient apply using a disability condition?
I would say it's worth at least exploring, and getting in touch with that transportation assistance program. I can't tell you what they'll say, but I think similar to some of the things that we talked about when it comes to requesting a workplace accommodation, making sure that you say, I'm requesting this for this reason based on this medical condition, and seeing what they can do to help you sort of see what might be relevant to you.
Okay. Are employed cancer patients and survivors considered protected by the ADA? And I think you talked about that a little bit.
Yes, so they are protected by the ADA, which basically means they cannot be discriminated against due to a history of cancer. Now, ADA enforcement is a little tricky, but basically it just means that, yes, you're protected. It's a civil right to have equal opportunity to benefit from engagement within employment or any other publicly available service that we mentioned. There's different sort of categories, but yes.
Great. We'll move on to another question. So I like this question. How can I support my mom and other survivors?
So I'll start, and if there's anything else to add, please jump in. But I think the first thing when it comes to experiences of lingering symptoms or breast cancer related disability, the first thing is really believing what they say if they're having difficulty participating in something that they want to do. So, even if treatment ended years ago, they may still be experiencing difficulties engaging in things. And the first thing you can do is be supportive of that. And if they say, I really am having a hard time doing this, say, I believe you, you know. The next is thinking about asking how you can help them, or if there's something that you sort of anticipate might be difficult. Say that somebody is experiencing fatigue and you've planned a full day family reunion. Touching base with them and saying, I know you might get tired. How can I set this event up in a way that you can still participate and feel supported and present? Maybe it's setting up a quiet space for them where they can take a rest during the event or something like that. But asking them what they need and believing them when they say they're still impacted by their experience. So that's what I would say.
I think that's really great, Amy. And I think also being willing to take some of the load with the information seeking and gathering related to solutions. So if someone has been experiencing cancer-related disability, Amy and I have provided, a list of resources that you yourself as an advocate for that individual can go through and maybe find tips and tricks that can help supplement their own search that they're doing. We know as cancer patients who are active in treatment or even post-treatment, medical schedules are complex and your lives are complex. And so lifting some of that load or some of that burden by diving into the resources with those individuals can be extremely supportive, because we all know we can get, lost down that web of the internet, and and sorting through all the information can be sometimes the hardest part. So being that support to help digest and go through that information.
Wonderful. I want to go back to when you were talking about physiatry. Am I pronouncing that correct? And so I know that you were talking about some of the other modalities, that how they get referrals, but how do they get referred to physiatry? Is it covered by insurance? Can you speak a little bit more about that? Because I am very interested. I had never heard of this before.
Yeah, absolutely. So physiatrists are typically located in hospital-based settings. You can find them within academic medical centers or community hospitals. Physiatrists, you would typically get a referral from your primary care physician or oncologist, but there are some insurance programs that don't necessarily require a referral in order for you to call the physiatrist's office and book an appointment. Physiatrist falls under what would be called the specialty or specialist category. So based on what your individual plan is, whether you have co-insurance, copay, or deductible, you would still be required for that. Again, double checking whether that physiatrist is in your network or out of network, if that's an option. But once you sift through, again, those moving parts of all the lovely insurance programs, physiatry is accessible as a specialist appointment.
Wonderful. One last question. We are almost out of time. When applying for new jobs, there's a voluntary disclosure of disabilities. Cancer is listed. Should I check the box? And I know, again, most you actually have some great resources, but is there anything that you can advise?
So the biggest thing with this, similar to requesting workplace accommodations, is it's really up to you. There is a lot of good information on that Cancer and Careers website about applications to jobs that I really think, if this is something relevant to you, might be helpful. But you're not required to disclose anything. It's your choice whether or not you want to check that. And so you really just need to think you're not going to be penalized one way or the other. But it's up to you what you want to put.
Thank you for joining us today, Amy and Rochelle, and thank you everyone for joining us. Have a great day.